Hello, and welcome to this short session on 4 simple steps for reviewing a patient's sensor-based glucose monitoring data using the AGP report in LibreView. The AGP report is a single-page summary of key glucose metrics, trends, and patterns, so you can quickly see what is going well and helping you to identify those times when your patient's glucose levels require more attention. Step 1. Validate the glucose data and review the key glucose metrics. First, check that at least 70% of the data from the past 14 days has been captured, as recommended by the current guideline. Check that the most recent date range is displayed and that it is set to 14 days. You can also confirm by checking the percentage time that the sensor is active. Now look at metrics such as average glucose, glucose management indicator, and glucose variability, and check the patient's time in range. The current recommendation for most people with type 1 or type 2 diabetes is to aim for at least 70% time in range, recommended as 3.9 to 10 millimoles for most non-pregnant adults, with no more than 4% time below range, less than 3.9 millimoles per litre, and no more than 25% of time above range, more than 10 millimoles per litre. Before focusing on areas that need attention, do congratulate your patient on any improvements and positive changes that you have noticed since your last review for an encouraging start to a consultation that supports effective and open discussion. Step 2. Identify any episodes of hypoglycemia and if there is a regular time of day that they occur. Resolving hypoglycemia should always take priority when considering treatment options. The AGP section will help you to see times of day that hypoglycemia events may be occurring. Look for where the dark blue band crosses below the lower green target line. This is an indication that hypoglycemia at this time is common. If only the grey band is falling below the target range, hypoglycemia at this time is less common. This is a good time to look at the daily glucose profiles to identify any particular days that hypoglycemia happened, so you can discuss possible causes with your patient. Perhaps too much insulin or glucose-lowering medication, not enough food, or an increase in activity or alcohol intake. General advice is that you should only address any hyperglycemia once any hypoglycemia issues are resolved. If there is no hypoglycemia, then you can move on to step 3. Identify any patterns of hyperglycemia on the AGP report. Look for times when the dark blue band is crossing the upper green target line, indicating that hyperglycemia is happening frequently at this time of day. Check the daily glucose profiles to see if there are any particular days that hyperglycemia is occurring, and discuss with your patient what the causes may be. They could include insufficient insulin, timing and dose of insulin, increased food intake or snacking, reduced activity, or illness or stress. Step 4. Identify glucose variability. It is helpful to look at both intradaily and interdaily glucose variability. Intradaily glucose variability is looking at how much levels swing between low and high in one day. This can be seen on both the daily glucose profiles and the ambulatory glucose profile. Large glucose swings can increase the risk of hypoglycemia. Interdaily glucose variability is when levels may be inconsistent from one day to the next. For example, one day at breakfast, glucose may be low, and another day at the same time, it may be high. More variability is indicated by wider dark blue and grey bands in the ambulatory glucose profile. Narrow bands show less variability, which is more desirable. High day-to-day glucose variability can be an indication that your patient is inconsistent in managing their diabetes, and there are more factors to consider than insulin dose adjustment. The patient may be inconsistent with their dose and timing of insulin, particularly in relation to meal times. They may be selecting lumpy injection sites or have poor injection technique, or they may have inconsistent meal sizes or proportion of carbohydrate. Sometimes there are lifestyle or behaviour-related causes. such as unplanned activity or exercise, occasional alcohol intake, or stress or illness. And then finally, it is important to agree some actions with your patient based on what you have discussed. Agree on the single most important aspect of glucose control to focus on next. Always address any trends to hypoglycemia first. Agree realistic actions, document them and write them down for your patient, and arrange a timely follow-up. We hope you found this short session breakdown on the AGP report 4-step process useful. You have now completed our series of bite-sized videos.